Hi, I'm Nicola.
And I'm Julia.
And we're the project leaders from YMCA Malta on the My Voice to Europe project.
My Voice to Europe is an Erasmus Plus project co-funded by the European Union that is being administered through the European Union Programmes Agency.
My Voice to Europe has brought together a group of young people to share their thoughts, ideas, and research on topics that they deemed important for the Maltese Islands.
These young people have developed 13 important themes and produced 13 podcasts with stakeholders, young people, and professionals related to the theme.
Keep watching and engage with the discussion in the comments.
Hello, thank you for being here with me today to discuss youth and redefining sexuality. My name is Kyle. I'm a trainee Gestalt psychotherapist by profession, and will be taking part in this project to discuss these very important topics. So let's start with an introduction. Maria, maybe we can start with you. You can tell us a bit about who you are, why you're here today, and so on.
So, hi, I'm Maria. I'm a practice nurse specializing in sexual health. I have been working, this is my 5th year working on sexual health now, with the Health Promotion and Disease Prevention Directorate, which falls under the remit of public health. And my role basically is promoting good sexual health, make people more aware of their sexual health, and eventually aiming for better and more safer sexual practices and less sexually transmitted infections. That is my main role, by providing education, material, resources, and whatsoever.
Thank you, Maria. It sounds like a very interesting line of work, full of outreach potential.
Yes, a lot.
Antonella, would you like to maybe introduce yourself too?
So, hi, I'm Antonella. I'm a 3rd-year medical student, but I've also just graduated with my master's in neuroscience, where I investigated the neural activity of sexual arousal. So my passions are kind of focusing on mental health and sexual health and using art to raise awareness on these topics and start healthy conversations with workshops and trainings and so on. So yeah, that's it. I'm still a student, but I volunteer quite a lot on to raise awareness on these things, and I really enjoyed doing my research last year as well. It helped understand the concept of sexual arousal even on a local perspective. So yeah.
Thank you. I think it seems that the both of you have a passion for education and making sure that the people are informed. Okay. So maybe we can start by discussing what sexuality is and how, maybe Antonella, you can start. How can you define sexuality in the context of today's youth? Because of course, sexuality as a definition, it's been changing for, I think, since as long as we've heard about it, it constantly changes. So how do you see it fitting into today's world?
Okay, so sexuality in general kind of explores different parts of one's identity when it comes to emotions and attractions towards other people, but also seeing yourself as a sexual being and exploring that, which is equally important. There are obviously different elements to sexuality. There's sensuality and the more intimate part of it. There's also the identity part, and when it comes to exploring that and your gender identity as well, and your interactions, your sexual interactions with other people. And there's a lot of psychology behind it as well. It's not just having sex and that's it. There's a lot of psychology that goes into it. Now, in terms of kind of exploring that from a youth perspective, I think we're living in a time at the moment that is advancing a lot in terms of the sexuality kind of aspect of it all. There's more identities and people are feeling more free to explore their own identity, to identify with different ones, to explore kinks, to explore a lot of aspects of sex. But at the same time, we do still come from an era with our parents and different generations where there was a lot of shame and stigma, even in certain sex ed, if there was any at schools. So it's like a weird in between of we're advancing and we're feeling more free, but there's also the internalized shame coming from our past, which we need to explore and help more in. So I think, yeah, we're in a weird, like, in-between era at the moment where we're bombarded with new ideas and experiences, but also, you know, there's the internalized
Definitely,
trauma.
definitely. And I think even relating to what you said, as I was growing up, I was taught the kind of the binary of it, right? That there's only gay people and there's only lesbians.
Yeah.
But now
Yes.
growing up in today's society, I can see how this has expanded a lot. And I'm actually curious, Maria, maybe in your field, how you experience this, how sexuality is seen, how is it, what is the context that is there?
Let's put it that way. I'm older than you both. So my era there weren't much. And my times being gay and lesbian was still a taboo. There were males and females. But I can say that I had a very good sex ed for those days.
Okay.
I'm not old, but my generation, it was more emphasized on how not to get pregnant rather than identifying oneself and
Mhm.
how I can show my sexuality, or as how I feel about my sexuality. Feelings were rather more hidden. It is more the aspect of how one can have sex rather than how would you feel like during sex, or what should you do during sex. We were discussing a lot the aspect of consent, for example, during the sex education in my time. But now it's part of oneself sexuality, like growing up yourself into what you want and what you don't want in your life. I really want that in my children, for example. What do you really want is mostly important to define your sexuality, because otherwise, if you don't accept yourself, how can others accept you?
Definitely.
I don't need acceptance, to be fair. I can do what I feel. But let's put it that way. Sometimes you seek that acceptance from someone, at least someone very close to you.
And validation is very important, especially when we're talking about the topic of sexuality. Being able to find yourself in spaces, being able to see that, we are learning about people who do not fit the stereotype, maybe, or people who do not necessarily follow the straight line that everyone else does. So it's important for us to kind of bring this to the forefront. Yes. I think what is very interesting in this conversation that we're having today is that we have different generations talking between us, because Maria, as you said, yes, you are over there, but I feel like that gives us an advantage over if it was just me and Antonella, for example, because times change. And it's very interesting to see exactly how these ideas change as well. Maybe we can expand a bit on this and discuss the key aspects that need exploration in relation to youth and sexuality. Antonella, maybe we can start with you again.
Okay, so first of all, about what you said, that having different generations as well, I really agree with that. And I think it's special because we, like, different generations have raised us. So in order to understand ourselves and to understand the youth perspective, we need to also understand older generations' perspectives, because those still influenced us. It's not just what is happening right now that's influencing us. So that is definitely something to explore and understand. When I started talking about sexuality more with my siblings or my parents, it helped me understand why I am the way I am. And I think something else that really needs exploration is focusing on internalized shame or guilt or whatever internalized feelings there are with sexuality, because it's something that's not kind of talked about enough. When we talk about sexuality, okay, there's the aspect of how you are with other people, there's STDs, there's pleasure, there's everything, but how you feel on the inside and how past experiences have made you feel is not something that's explored enough. And it's something that causes a lot of problems, because even when we see the higher STI rates now, a part of it is the fact that sex has been so stigmatized and there's so much shame associated with that. Getting tested is a difficult thing to go through for some people, that talking about STIs with your partner is something that not everyone is doing at the moment, or maybe you feel a bit of guilt when or shame using protection or asking another person to use protection. So because there aren't a lot of healthy conversations surrounding it, then the healthy aspect of it during sex can decrease as well. And we see this as well, like when I give workshops in schools, in the beginning, there's a lot of laughing and giggling and turning red because it's not talked about in a healthy way. With friends, a lot of the times, it's talked about in a comedic way as well. So we need to have conversations where it's just another part of our being, a core part of our being, and it doesn't need to be stigmatized. It doesn't need to be comedified, kind of. It's just that, and we talk about it the same way we would talk about, I don't know, other parts of our body or other parts of our lives, like career and friendship, you know? And also a focus on pleasure. We, as Maria said as well before, it was more about kind of STIs and how to have sex and so on. And you know, growing up, there was the idea of sex is pregnancy and having kids, or else on the opposite negative side, STIs. But what about the pleasure? Like, what about the pleasure aspect of it and exploring that? It's also important. So we need to change the way we talk about it as well. Obviously, mention STIs, but mention how beautiful it can be as well, you know?
And I think having that conversation will allow for this shame to make its way out, maybe, of the
Exactly.
situation. Maria, what are your thoughts about this?
Antonella got me to think. I always ask the first question, why do people have sex? And at first, as you said, they start laughing. No, we're going to talk about sex or something like that. But eventually, I always say it's an activity of daily living. Otherwise, I won't be here and the population won't be here. So let's talk about it and face the reality.
Normalize it. Yes.
Because why? I mean, yes, it can be laughable because it's enjoyable. That's why you laugh. When you see a bar of chocolate, you laugh at it, you smile at it. Why? Because it's nice and it feels good to take it. It tastes good. So, yes, the aspects of sexuality is getting bigger and bigger, and somehow my perception sometimes people might feel a little bit mixed up. Why? Because we have the internalized bias that comes from, as Antonella said, from parents, from siblings, from friends, from education, from the surroundings, from the social media. So somehow it could be very difficult for oneself to identify, or at least to put yourself into a position. Yes, the aspects can be quite broad into understanding. First and foremost is the subject. What is sexuality? What do you want to do with that word? Do you really want it to be part of your life, or do you want to go with flow bit by bit, exploring it? Because you can start off at one point and finish at another point.
Definitely.
So yes, it's a big umbrella with different aspects, and the knowledge of the human body and its development and its function are good. But how am I feeling, and how are my feelings, and where I am going is another aspect that is very important.
It seems like these topics are often misunderstood, maybe as well, and there is a lack of interest, and the shame keeps us from even being able to talk about this in an open way. And it's very interesting, both of you, to be saying these things. Maria, what do you think the specific challenges or perhaps upcoming problems that youth are facing nowadays in relation to sexuality and how they explore it? What are the things that need most urgent discussion? How do you experience this in your line of work?
My experience is the different messages that the youths are receiving, and not just the youths, because the whole generation from A to Z, from social media, for example, the different messages and what type of messages. For example, if you go into social media, even if you go to one app, for example, some people will think that what they see is the reality.
Yes, yes.
Which is, in fact, it's not always the reality. For some people it works, for others, for me, for example, it doesn't work. But we assume that this works, this is going to work for everyone. And I can see that sometimes it's by nature that we tend to like that thing, we try it, and then we cannot define our boundaries with our sexual partner, for example. Antonella mentioned kinks. If you don't know what you're really going into, you need to go step back, learn more, and then go into do that. Check your boundaries first, because otherwise you can go into. I feel that sometimes we go into things that we're not really ready to go into. It doesn't mean that you don't want. It doesn't mean that I'm not telling you not to explore. Far from it. But first, we need to know what we really want. To know our boundaries. We do it consensually. So eventually we know what we're getting into. Very good. I mean, sex is nice, it's pleasurable. You can explore it in different ways and means, and that's okay. That's how I explain it. It's okay, but check your boundaries. See where you really want to go. If you don't want to explore that type of sexual activity for now, or if you want to learn more, there's no need to fast track it just because the social media is really emphasizing on it, or just because of your peers are doing it. In my times, we used to talk about peer pressure a lot. Now there isn't only peer pressure. There is social media pressure. There is familial, even between siblings pressure. Everything is like we're having a lot of arrows directed to us without me what I'm going to do, or else if I do that, if I take a decision to do it, am I really ready to do it? We're not teaching, for example, abstinence anymore. If you want to abstain, it's okay. Feel free to do it. But if you really want to go, if you really want to engage in your first time sexual activity, for example, be sure what you really want. Because we talk about the first sexual activity, it's okay to delay it a little bit, for example.
Something that is seen as very important as well in our society.
Yes, I mean, my times they used to abstain. You cannot have sex until you get married. At least now we changed it a little bit.
Now we know that abstinence doesn't work.
No. I cannot talk for everyone. Let's put it that way. There are certain, not religion, but some sort of that they emphasize on abstinence. But for those who do not want to abstain, I always emphasize: be sure what you really want. I know that sometimes sex can just happen. But let's get informed from reliable resources and from good sources, so that you really know what at least you have some sort of, you won't know everything until you experience it. Let's put it that way, but at least you have some sort of information that you can rely on. And one point is, you're talking about youths, but these youths are growing up. And I can see a difference. For example, the youth in my generation or older, I mean, the youth, for example, my brother is 10 years older than me. His generation thinks that, for example, using a condom is something not heard of. Okay, and that's a thing that came into my mind when I started off trying to promote the condom. It was, and it's still a very difficult task to promote it, because very few people want to use a condom. But and I can understand why. But I never used. But the reason behind it is I've never used it before. How I'm going to use it now?
Lack of awareness. I think that's where this comes in.
Not awareness. I think it's more education
as well. Yes,
because they know about the condom, but not everyone knows how to wear it, and that is something that hinders people from using it. For example, during sex, and it is from the experience from not from literature only, but as well from the outreaches that we do and from the lectures and talks that I do all over the place.
And the topic of condom use is something that is widely spoken about in reality. So it's very shocking to know that even people nowadays are still finding it difficult to kind of see it as a safe measure, as something that can help them and something that can prevent certain diseases and unwanted pregnancies. So
Kyle, I find 50-year-old people and still asking, for example, yesterday, still asking, so if you use a condom with strawberry lubricant, how does it smell?
I see.
And I was like, strawberry?
Yeah.
So yes, they didn't even touch one time a condom. Even I am having 18-year-olds, 19-year-olds, and touching a condom is like touching gold somehow. Because it's still, we are in 2025, and holding a condom in your hands is something that is very difficult to do. To buy it, although it's available in the supermarkets, it's available in pharmacies, it's very difficult because the shame and the guilt that Antonella mentioned is very there, is so there that until you give it to them and they try it themselves, it's very difficult to go and buy it. And I really want to emphasize on that decision making and the ability to do it yourself without others telling you what to do.
Antonella, I'm wondering if you have anything to add about this.
So I agree a lot with what Maria said, and especially something that stands out a lot is the importance of knowing your boundaries. And I feel like life is getting more and more sexualized, which I mean is good that we're more open about it, but the pressure that people feel to have sex and be sexual, even when sometimes they don't really want to, is really intense, even through movies, through friends. Like no one wants to be the last one from the friend group who hasn't had sex yet or who hasn't done this yet. There's a lot of pressure, and it can be a bit damaging because it can push you to do things that you're not ready for, and then that's traumatizing in its own way, or you get an STI and that's kind of its own thing. So it is important to know your boundaries, and it is important to have more education because even, for example, porn, it can be important for different reasons, but there are a lot of kids growing up now whose only lessons are through porn. And I mean, there is some more, exactly, like there is some more ethical porn that kind of portrays things in a more realistic way, but that's not the porn that most people watch because most of it you have to pay for it. So a lot of the main porn out there is quite unrealistic. So if you're growing up and that's where you're learning your sex ed from, and that's the idea of sex that you have, it's gonna kind of regress you and your partners as well. It's important to just explore it yourself in a healthy way and understand what you want to explore and when. Because even not just sex, but we romanticize having a partner, being in a relationship from such young ages. I mean, I have little like 7-year-old kids saying, oh, because my boyfriend, oh, because I want to get married and this and this. Like, just be a child first, you know? Like there's your entire life to be in a relationship, to do this. Like, enjoy the different stages in your life. And just because you started having sex doesn't mean you need to have sex all the time. Like, you can still go a few months without it, or a year, or whatever you need. And also understanding the repercussions of, for example, sexual assault and these kinds of things that happen so frequently and can have a lot of repercussions on people. And because we're not educated enough about it, then it can lead to either really risky behavior, or else it's difficult for you to have sex again. Like, there's a lot of things that can happen with it, and we need more education on it because it's important to know what's going in your own mind and body after such experiences. So yeah.
I
there's
think
that too.
something that really struck out from what you said is having these realistic expectations.
Mhm.
Because I feel like if we have all these unrealistic expectations, then you're going to meet up with a partner, have sex for the first time or whatever, and end up feeling disappointed. This sense of shame is there once again. So I like how this topic somehow linked both Antonella and Maria's point, because we can see the two sides kind of the coin. So in relation to this, now, of course, our project is here to kind of pass on this message towards MEPs. So how can this better understanding, maybe this need for education that you're both advocating for, of sexuality among the youth, contribute to more informed policies at the MEP level? So kind of, does this work? Will this not work? What are your opinions on this, Antonella? Perhaps you can start with this.
So I think there are a lot of changes that can happen from an MEP point of view or policies and so on. I mean, first and foremost, a better sexual education policy in general and encouraging sexual education both to kids, but also to parents and to teachers and other educators, because obviously the kind of sex talk at home as well is also going to matter between friends, between everyone. And
Of course.
if like also maybe incentivizing voluntary organizations to help them give more workshops and trainings. Most of the kind of peer-ed sessions, workshops happening in schools are happening on a voluntary basis, and it's nice. But even, for example, for me, like a lot of friends tell me, if you did a part-time job instead of volunteering in all these organizations, it would be better financially. But this is what I'm passionate about. But helping, like if you don't have enough educators that know enough about sexuality, then at least help the organizations and people who do know enough about it to give that education in schools.
Bridging the gap, truly.
Exactly, bridging the gap, it's really, really important. And even, you know, free menstrual products and kind of contraception, they can be so expensive. And I've had friends tell me like, okay, yeah, but condoms are really expensive, so it's better to just not do it, like with it, you know. And like it's a shame, you know, it's not the ideal thing. And also understanding, I think, bridging gaps as well between different cultures, different religions. I mean, I remember being taught in religion class how sinful masturbation is, and yes, like abstinence, and it's okay. I mean, different religions are going to have their own beliefs, but it's okay to also explore, this is what religion says. These are other options. You're not saying one of them is bad, but you can explore it and help with that. Um, and again, kind of addressing a lot of different aspects of sex. It's not enough to just talk about STIs. It's important to talk about pleasure, and it's important, especially to address sexual assault, rape cases, because they happen a lot, like an unbelievably high amount. And it's not just us that find it difficult to deal with it, but it's also professionals, doctors, um, police. A lot of people find it hard to report it because most of the time going through the system can kind of invalidate your experience or re-traumatize you. So it's not hard enough to go through it, but it's also hard enough to do anything about it. So this needs to improve. We need to educate professionals. We need to educate police on how to deal with it. And even if sometimes it's out of your hands, even if sometimes there isn't enough evidence, there isn't anything else that you can do, just showing empathy and some humanity and compassion to the victim and to the survivors, that, okay, I'm sorry this happened. There are these people that can help. There are many therapists that can help. Like that's also important, because sometimes all you need is just validation and some compassion with what you went through, you know. So it's an issue within the entire system, you know, that slowly needs to improve. But I think in general, this education and actually reinforcing education, not just saying teachers should talk about blah 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 and then it's not actually happening, because the teachers also need the education, the police also need the
Yes, of
education,
course.
you know.
Mhm.
So yeah, I think it's important to not shy away about the more serious topics as well, because unfortunately they are there. It's a part of many people's lives, and a lot of people have to suffer through it alone.
Mhm.
And it's not fair, you know. There needs to be more support on that.
Definitely. Maria, maybe you can share your experience as a sexual health nurse. I believe that this is something that really matches with your experience.
What something to build on is about, I wanted to talk, I really want an emphasis to start off from the sexual education point of view is about sexual dysfunctions, for example.
Yes.
We are having a lot of messages related to erectile dysfunctions, premature ejaculation, and also vaginismus, for example, dryness, and the lack of information when it comes to these, let's put it, problems, put it that way, or conditions, and this can bring about this can be brought about from different aspects. I mean, from psychological point of view or from medical point of view. Unfortunately, we don't have the services. I mean, we don't have just one service for sexual dysfunction. It's quite fragmented. You have to go to either a urologist, you have to go to a gynecologist, for example, or else you need to, if you go to the private health sector, it's one thing, and the difficult government health sector is another thing.
Mhm.
And let's put it that way. Sometimes sexual dysfunction, for example, neurology, can be found at the bottom of priority, rather than having someone, for example, with a tumor in kidneys, or in testicles, for example, or there's another issue when it goes to the genitals. So it can be put down into the not seen as a priority. But for that person, although we don't recognize, although we are shy to talk about sex, when it comes to your problem, then it becomes a priority.
Of course.
And for example, I'm having questions, I'm diabetic, and I'm not performing, for example. For that person who always was able to have sex quite good, and now he cannot perform, for example, it can be somehow traumatizing for him.
Mhm.
He has a lot of guilt because he cannot satisfy his girlfriend or his boyfriend or whatsoever. So sometimes this issue, even the issue, for example, of stress, the amount of stress that the youngsters are having from school or from work, we cannot find the work, the appropriate work, for example, or we're working long hours, or else we're going to the university and we need to work. Or else, for example, school, the amount of homework that we have, the exams that we have, and you're not able to perform, or you are really performing when you shouldn't performing, and this can be an issue for that person. And yes, sexual dysfunction is one of the topics that I really want to emphasize on, and to look into when it comes, for example, to MBPs, because we don't talk about it.
That's very interesting. And the fact that you also mentioned, psychological issues that may be impacting sexual health. I feel like that is an area that definitely needs more discussion, because ultimately anything we go through impacts our entire health system. So these are all interlinked. To follow up on this, I would like to ask how you think our education system actually can be adapted to include this support that the education system needs to kind of teach our children about sex education, not just our children, actually, youths, teenagers, anyone really who enters the education system, to be more inclusive of all sexual and gender identities, for example, sexual health, and these topics. Of course, this is quite a big task to do. Antonella, how do you see this as developing?
So I think a part of it, now I'm come from a medical background, but I think a part of it is also important to move away from the medical, like the medicalized
Model, yeah.
sex, you know, because there's so much more to it. There's so much beauty. There's the psychology, there's the intimacy, there's kind of your sexual relationship with yourself as well. So we need to start seeing it from a more holistic point of view, like something like a reason why I really started getting interested in sexual health is because I found that it is the thing that interlinks everything. It's your physical body, your physical health, but also your mental health and your social health and social life. Like it really kind of connects everything. So it's important to start exploring all of this and to teach the importance of creating safe spaces for each other as friends, but also as professionals in order to discuss this. Recently, I was discussing in a lecture with some other medical students the importance of, as doctors, removing your biases and just supporting your patients, no matter what your views on a subject is. Because, for example, a lot of medications affect your sexual life, affect your libido, everything. So this kind, like psychiatric meds, even some cancer medication, and doctors shy away from discussing this aspect of drugs, this side effect.
Patients will not know.
Patients will not know. And if they feel kind of the awkwardness coming from the professional, they for sure will feel awkward to bring it up. And in result, this leads to a lot of non-compliance of medication as well. So that's going to screw everything up ultimately, because they're like, okay, I'm sick of this. Like, I'm just gonna stop the meds and get my sex life back, or get this aspect of my life back. And then it just kind of continues spiraling from there. And even the ability to just, a person needs to feel safe in order to really open up about their sexual history. For example, even when it comes to sex workers, if you go and you feel this judgment from police, from doctors, from whoever it is, then you're not going to open up about it. And it's so much easier to go, for example, for your GU testing and say, oh yeah, I had sex with one person and blah blah blah, like instead of opening up like, yeah, maybe I engage in sex work, or I've had multiple partners. And like, it's important, because it's only when another person is going to trust you that you can give the right sexual education as well. Because maybe sexual education for a person who's been in a long-term relationship will differ from a person who explores with multiple partners. Obviously, there's still the same basis, but you need to cater it for the person you have in front of you, because everyone's sexuality is unique, and that's something beautiful. But there needs to be an element of trust in order to properly kind of support someone.
I think especially since nowadays relationships are no longer only monogamous, so there are
Exactly.
polyamorous relationships, there are relationships that don't really fit the norm that maybe society sometimes tries to push. And actually, although this is something that's talked about maybe nowadays a bit more than past years, I feel like the discrimination that maybe these communities face is still there, despite it being illegal, for example, to discriminate against people of different sexualities, gender expressions, and the sort. These things still happen even in our medical systems, perhaps even in law enforcement. And of course, we're lucky because here we have it's kind of the opportunity to discuss this, and we're safe to do so, but not everyone does.
And what's legal does not always mirror society.
Exactly.
There is a difference, and most of the time societal change will happen years after the legal change. So that is something to consider as well, and focusing on, yes, inclusive sexual education. And it doesn't have to be, I feel like a lot of parents or a lot of people think inclusive sexual education means you're only going to talk about gay or bisexual or whatever and ignore the heterosexual. Like,
Yes.
there's this idea. It's not that. It's just, instead of having all books or all movies exploring heteronormative situations and heterosexual relationships, you can have both a heterosexual individual and the bisexual individual. And there doesn't need to be a main focus on either or, but to just normalize it. And even as an LGBT community, we need to work also on interacting, like making it less LGBT focused sometimes and just normalizing it. It's just sex. In fact, when I'm asked to give certain workshops on the LGBT community, I always say like, okay, obviously I'm going to discuss it, but I'm going to discuss sexuality in general because there's so much shame, there's so much to talk about and improve in the general kind of area of it, even for people who are heterosexual, that it can be more damaging to just focus on one community. We need to discuss it all together, and that's important as well.
And obviously, as you're saying, I think when we discuss it separately, kind of, we're creating more segregation, we're creating more
Exactly. Yeah, there's more putting each other in boxes, and
exactly.
you know that's a lot. Like even there's a sense of, I mean, everyone's exploring their identity. There's a sense of fluidity when it comes to gender identity, when it comes to sexuality. And I see a lot of people kind of suffering because of the fact that if you think that you are lesbian at this point in your life, and then 5 years later, you are attracted to this guy and you want to get into a relationship with him, the amount of mental and emotional stress that puts, because I feel like I'm betraying my community and it's not good to go back and now everyone knows me as this. Like, it's crazy that people like really suffer so much because of it. And it's sad because I mean, the ultimate goal of the community was to say love is love and you can love whoever you want, you can explore it, and there's fluidity. So it's important to focus on this and to just allow people to be who they want to be, to explore whatever they want to explore, because that's the beauty of it, rather than putting each other in boxes and kind of feeling betrayed if someone steps out of that box.
Definitely. Maria, do you have anything to add? I feel like this is very important in your aspect as well.
Yes, what I wanted to add is the thing is, we need to start from somewhere, because sexuality is a lifelong journey. It's not, it starts from birth and it continues. And unfortunately, I mean, I am a parent. We parents are not prepared, first and foremost, to be parents. I can say it from experience. I say that being a parent is the hardest exam every day, every hour, because it changes as well. Because you want to mold somehow these creatures into a very good way, different from you in their own unique way, but somehow you want them to be the best and everything, and you want the best for them. That's it. You won't really want the best for them. So speaking about sexuality into that context, and having that as a lifelong journey, it's not only about the education system, or it's not about what the policies are made of. It's about ultimately what the parents really want to integrate that into their children. For example, in my case, let's give my example. When it comes to when I have two girls, and I started from very young telling them which are the private parts and which are not. Which the hands you can show them off, for example, but the breast you don't show them off. The ones that you cover with the swimsuit are those private, and those where we don't cover. Somehow you need to explain the kids where and when they cannot, for example, who can touch them and who cannot. And I started off from very young. When they were like 3, they started off with the van, for example, going to school, toileting, for example. I started off, you know how to do it yourself. You can do toilet yourself and clean up yourself. And when I didn't let people to touch them, people were like, they're still very young. Why? I told them I educated my children. They know who can touch them, who cannot touch them. And actually, my oldest, because my oldest is really into that, never let anyone to touch her. And once they called me and told me, how come? She couldn't, she didn't let me. I said, oh, okay, well done to her. you really know about that? Of course I know. I taught her that. And that is somehow very difficult, even in my generation.
The resistance is still there. Although we're trying to educate, you're still finding resistance wherever you go.
Yes, and resistance from parents. I'm finding it so hard even to teach them. And they're not capable to teach their children because they don't know the full education. They took the education mostly from porn or from peers or from their personal experience, for example. They are shy to talk to their children about it. They do it themselves because somehow you are exhibiting your your experiences to your children and they are learning from it. For example, if I shout, they learn how to shout. So if I'm having multiple sexual partners, they learn that you can have sex with different partners, for example, not just, I mean, in my times, for example, having two parents together was the norm. Now parents are more free. I mean, there are more parents who are separated, for example, they have multiple partners. So they are getting these messages, the children are getting these messages, but we are not ready to talk about it because it's shameful to talk about it. And I'm finding resistance. For example, they're still very young. 9-year-olds, they're still very young. They are feeling those changes coming. They're having hairs, for example. Their body structure is changing. They're getting wet at times, for example. But the parents are shy to talk about it. Or else, no, I let the teacher talk about it. But if the teacher doesn't talk about it, who is going to talk to this kid? I mean, no policy is going to teach that child until we take it into our hands and teach them ourselves. I don't know whether you are understanding my frustration, but I'm finding a lot of resistance even in 2025 about the topic. So,
in fact, I'm remembering a few years ago there was this whole debate in Malta because there was some kind of book about sexuality for kids, and parents were saying that they were going to take out their kids from schools because some information was being depicted. And to me, I remember back then, of course, I remember thinking how extreme this was, that some parents felt the need to pull out their kids from school or to not allow them to follow these lessons. In my head, I'm always thinking, teaching them about this is for their own safety, it's for their own good, but not teaching them that is putting them in danger, it's putting them in risk. And this is, I mean, to me, it's a very important topic because growing up, the sex ed that I had, I mean, I don't even remember it being anything other than what's very typical. They teach you abstinence, they teach you that if you do this, this will happen. And so I missed out having that human kind of explanation of what sex actually is and what it looks like. And it's quite sad, I believe, that we are still here and we're still trying to kind of break away from this rigidity, as the both of you are saying, but unfortunately it's still there.
Yes, guys, sometimes, sorry to put it, but basically, for example, I find it's very difficult to go into post-secondary schools and they tell you, do not come with condoms. So basically they can vote, people of 16, they can vote. They can go, they can be mayors now. But they cannot use a condom. Or else I would encourage sex. As if sex is still really, really, really bad. So unless we don't start to speak about how important and how useful to talk about the subject, it's going to be useless.
And not talking about it doesn't make the issue go away. It just hides it.
Exactly.
It becomes an even bigger issue.
Yeah, that's the thing. The view of a lot of people is that if you talk about it, you're encouraging it or enforcing it. Like, no, it's happening whether or not you talk about it. So might as well make it safe, even within kind of the LGBT community. Parents think because if you show that a woman can be with a woman, then they'll have ideas, you'll confuse them, you're sexualizing them. And this, especially with your sexualizing them, I don't get it, because how is it that there are people having kids that are 3 years old and like, she's gonna marry this son of my friend. Like, do you have a boyfriend?
Well, yeah,
So
yes.
people are sexualizing kids and yet showing them different identities. That's the problem. Like, it doesn't make any sense, you know? And with kids, you are teaching them what society is. You are teaching them the norm. If you tell a 3-year-old that you can have a mom and a dad, but you can also have a mom and a mom, in their brain, it's going to be wired that, okay, this is what normal is. Like, you can have whatever parents you have. And it's not going to be sexualizing them. It's not going to be encourage them or making them really confused. It's just going to teach them a new norm. And that's what we want to strive for, you know? And again, like by talking about it, you're just making it safer and healthier and reducing the shame and stigma. You're not encouraging something that no one thinks about, because realistically, especially from a certain age onwards, everyone will think about it, everyone will want to question it and explore it. So might as well give the support and guidance for it to happen in a safe way.
And I'm glad you brought this up, Antonella, because it's actually something I think about a lot is, when we're talking about this sexualization of children, we seem to only be talking about queer identities,
Yes.
sexualized children, but we seem to be forgetting that, girls, for example, have been sexualized for centuries, ever since they're little, they're kind of formed to be appealing to men, for example. And it seems interesting to me how this is forgotten when it is something that's at the forefront. Very interesting.
There is kind of a struggle with compulsive heteronormativity as well, where as women, yeah, we are raised in a way of like, you need to be appealing to men, you need to do this for men, you grow up, you have a husband, you take care of the house. And so when you start exploring your sexuality and realize that maybe there's an attraction to women, or you're not sure if there's an attraction to men, like not everyone, obviously, people have different experiences, but from my personal experience and from a lot of friends, it's like there's this thing that you keep trying to get yourself to be into men. You keep trying. You're like, oh, but maybe, because it's how you grew up. Like, it's so strong from when you're a kid. Even, for example, the way little girls get compliments versus boys. Boys will get like, you're so smart, whatever. And with girls, like, you're so pretty. Like, you're so, which is, I mean, it's nice to hear you're so pretty, but
There's more to
also,
that.
exactly, there's more. It's not just one's aesthetic, you know? So yeah, it gets quite complicated. The seeking of male validation is a really intense thing, I think.
So in relation to this, how do you think we can create the safe space to be able to kind of explore the idea of sexuality with children?
You want to go first, or?
Basically, we need to check our biases, our internal biases. And we need to build a culture where acceptance and humility is still there.
Definitely.
And also creating those marvelous norms that we used to have, those ideal norms. And nowadays, we are going a little bit further away, our expectations. We expect to have a perfect relationship, for example. We expect to have a perfect sexual relationship where everyone is hardcore, for example, where everyone can have sex every day, which is not always there. We're building new norms, which sometimes are not always reachable. Why? Because of the stresses of life, because sometimes you can get sick, sometimes you don't feel like it, and that is bringing a lot of problems. For example, into sexual assault, and because somehow we go into a relationship, we accept things that we don't know that we can say no at some point in time in our sexual relationship, for example. People, sometimes I find it very difficult when I tell them, you can stop at any point in time during sex. And they would say, Even with my partner, of course. This is your body, your life. You decide what to do with it.
Mhm.
So yes, those expectations are really are really making me really frustrated, because the ideal we are putting in a very difficult ideals that somehow is very difficult to reach.
Mhm.
And first and foremost, and before everything, is how we address people. We need to have an inclusive language, which in my field I'm finding rather difficult.
Mhm.
When I say, for example, how I identify myself, and I say she, her, what do you mean? As if I'm talking in a language that no one understands. I mean, I believe that she and her was there as pronoun when I used to learn English grammar.
Always been there. Pronouns have always been there.
As always, then my kids are learning pronouns now, and I'm learning with them as well. So, what's the difference? But that change is happening. It's happening fast, and unfortunately, some people are not ready to accept it. I mean, we need to face the reality. It is happening in a good way. The change is happening in a good way, but the resistance from some people is making it very difficult and putting a very dark light on the topic, on the aspect of sexuality. I mean, that's a negative part. I don't want to be
No,
traumatizing, but this is the reality that I'm
yes,
feeling.
exactly.
And ultimately, the resilience.
Yes,
The
resilience
aspect
is
of
very
resilience.
important, of course.
I think something that kind of summarizes what you were saying as well is the importance of just accepting and understanding imperfections. Like, it's okay to have a bad sexual encounter or one that wasn't that good, and it's okay to talk about it as well. And it's okay that, yeah, you're not always going to want to talk about sex. And it's okay also to understand, as Maria said, to remove your biases and to understand, even as patients or students or whoever you're interacting with or clients, that they might not always, for example, use a condom or so on. And that's okay as well, because I mean, I help with exactly, like, I help with HIV testing, and we have a questionnaire to kind of gather statistics and so on, and we do ask about condom use and so on. And when people, like, I can sense if someone says never or sometimes there's this, like, it's hard for them to say it. And I always tell them, it's okay. Like, it happens to the best of us. It's okay. Like, I go on to explain, like, ideally you do use a condom because of STIs, of pregnancy and so on. But you don't need to feel all this guilt if you don't always manage to. If like, because it's one way of saying it's okay, but we can try for the future to kind of use it more or to gain more awareness, versus, oh, how dare you do that, like you're damaging yourself. Like, this, there's a way and a way of saying something, and it's okay to understand maybe someone, yes, is going to end up pregnant, and maybe because they didn't use a condom, but sometimes they do as well, and the condom can tear or something like that. It's important to just go with as few biases as possible, because if the person is going to sense all this judgment, and if you're going to say it in an aggressive way, then they're less likely to take in that advice and to take in that information and research about it. So it's important to be compassionate and to understand that mistakes do happen, that we all have our imperfections. It's impossible to be perfect all the time in any aspect of your life, but including your sexuality. And we just treat ourselves and each other with a sense of respect and with a sense of compassion and understanding, so that hopefully we can learn from whatever experiences we go through and be better for the future, because that's all that we can do. There's no point feeling guilt of what you did in the past or shame about it. We just kind of can improve moving forward.
Definitely. And with this in mind, how do you see this topic to be able to kind of provide suggestions for MEPs and as perhaps potential solutions for these things that we've been mentioning, these rigidities we find? What do you think is needed to be put forward to these MEPs, Antonella?
I think to support sexual health campaigns, to
Mm.
support sexual health educators, because like a lot of MEPs as well will shy away from these topics, will shy away from the topics of reproductive health and so on. Again, it's kind of seen as less important sometimes, but in reality, it is very important because it's affecting a lot of different aspects of yourself, and it is a big part of people's lives. So even just by, for example, maybe putting less money into sexual health campaigns or so on, you're giving in, even if subconsciously, you're giving people the idea that it is not
That's
as
important.
important
Mhm.
as other things. The stigma, the not talking about it is giving that idea, and people are taking it in and viewing it as less important for themselves, and that creates a vicious cycle.
Mm.
It's saying you have to go to the dentist every 6 months. You should check up with a doctor every year, every few months.
Exactly.
But do we mention the GU clinic? A lot of people don't even know what the GU clinic is. You should also be getting tested regularly. It's not just when you have this painful symptom or weird presentation that you should go check, because that can already be kind of late, So like encourage this testing, work on improving the GU clinic, allowing for more people to be working in this field, incentivize these things, incentivize voluntary organizations that are working on it and campaigns, because it is important. By people who have this authority, by MEPs prioritizing these things more, it's already giving a change to it in society, because it's already putting forward that message that we are focusing on this. It's the same with mental health, but I think
Exactly.
the mental health system and kind of biases are advancing at a bit of a quicker rate than sexual health. But so it's important to give this, and for MEPs to be able to talk about sex and sex ed and so on as well themselves, because if they
Of
can't
course.
even talk about it, how is there going to be change in our policies, legal system, and in society in general? So yeah.
I agree. Maria, what can you add to this?
Sometimes it can be controversial, so it's better not to talk about it. Yes, I mean, we need more people to talk about it. We need more. I mean, in my experience, I mean, in my field of work, I would love to have more people to share their experiences, for example, but they don't. Why? Because they don't feel that if they're gonna come out there, they're still gonna be
Yes.
stigmatized, or they're gonna be shamed about it. So I find it rather difficult to find people and share their experiences. When it comes to sexual health campaigns, as Antonella knows, I try to be everywhere, but sometimes it's not always possible because of logistics, it's because of financial aspect. It's
Power
because
to be there.
And if you're one person that has to be everywhere, that's so intense on you as well. It's if it's just one person doing all the work, how is that possible? There's a limit to it. So, we need more people. But there's also there's also stigma in that. It's like you don't want to be the sex person. You don't, because there's so few people talking about it, it's like once you talk about it, people will know you as that person. And sometimes it can demotivate you from talking about it, but at the same time, we have to start somewhere,
Yes, definitely. And there's a lot of pressure as well. At the same time, there's a lot of need for this, but the resources are what they are.
Mhm.
So I think here it is very important for these MEPs to realize that there's a very real issue, and unfortunately, we're not getting any real resources, or these resources that we are getting are not enough. And it's very interesting how this conversation between us has kind of evolved in the past hour. And I think the main aspect of this is to talk about these diverse sexual identities, diverse sexual experiences, because when that happens, we are able to kind of foster a sense of community, foster this idea that, you know, sex is normal. This is a thing that happens. So perhaps we can close off by seeing what is needed from Malta and what we can take from other countries. Maybe if you are knowledgeable about how other countries approach this. Antonella, how do you see this maybe in Malta's context?
So in order to do my master's, I had to collaborate with, I love her so much, my co-supervisor, but I had to collaborate with a co-supervisor who is Maltese actually, but she lives in the Netherlands and she has her own kind of sexuality research happening in the Netherlands. And I went there for a month and the difference was insane. Like in Malta, I was the only one doing neuroscience research on sexual arousal. Kind of no one in my lab in Malta really had any knowledge on it. It felt very isolating sometimes. Going there, I think, there were two main PhD students working on it, about 15 undergrad students, master students working on it. Like they had an entire lab dedicated to sexual research. It was insanely different. Like people are so much more open to talking about reproductive health in general that I was so surprised and I felt sad that we didn't or we don't yet have that in Malta. Even I went to Canada as well. It was like everyone was just so open. There it was the place where I felt like sex was normal, different identities were normal, and that's it. So again, I think pushing forward this kind of research, I was from a more scientific, but I know that there is an increasing number of students doing kind of sexuality research in the psychology department and so on. So pushing these forward, encouraging that there are more groups and funding going on for this research as well is such an important thing. Because again, if you're here trying to, like, I worked on it because I was really passionate about it, but if you're trying to do this but getting resistance back and feeling like your research is not as important because it's about sex, then
Will be supported.
exactly, it's going to demotivate you. So I think this, like helping with research, helping with campaigns, making it more normal to talk about it in schools is quite an important thing. And also to teach people that it is their own sexuality that matters. Because nowadays, you know, you're either too slutty or too non-sexual or too this or too this or too vanilla or too kinky. Like it's to everything, you
Yes.
know, and there's so much pressure and you start getting like, okay, I need to be this in order to be attractive, or I need to do this in order to have a good sex life. But in reality, the sexual life and the sexuality that really matters to you is your own and your partner's. So explore in whatever way you want, take it at the pace that you want, and just enjoy it and just embrace your own experiences and be open to sharing it with others. But you know, it's okay to take everything at your own pace and to respect your boundaries and do what you need to do.
Mhm, mhm. Definitely. Maria, maybe there's something that you can say in this regard.
Something that we missed, I think, and I think we should. I mean, sexual health. If you want sexuality and sexual health, you would need a whole day, not just 1 hour.
Yes.
Is disability and sexual health and
Very
sexuality.
true, very true.
Although, for example, research says that I'm not all research, even from my experience, they can still masturbate, for example, they have still feelings, they can have still, they can still have sex, but we don't recognize the fact that they can still do it. They do it. They have to do it. They want to do it. And we can put a lot of research there, but one's experience is the most important thing that we need to address. Is being different or being out of the norm or being you is the most important thing. We can put a lot of knowledge, we can put a lot of research. We don't, unfortunately, Malta, we don't base all these things on research. If students do their research, they leave it there on the shelf and nothing comes out of it, unfortunately. Even sometimes big research is there to stay on the shelf, unfortunately. We have to go abroad, we have to see the outer space. But to implement it in Malta, sometimes it's very, from my experience, I find it very, very difficult because we're not open-minded as the Netherlands, for example. We take part of EU projects all the time. I have 2 projects going on at the moment, but somehow our mentality or our laws do not permit us to go further, for example. When it comes to, for example, the HIV, the criminal law, or the syphilis criminal. So, there is research, and there is very good research, but to implement it, you have to
structure things.
Yeah, structure it really, really, really good into what is happening in the islands, basically. Because even between Malta and Gozo,
there's a huge
difference. Oh my God, I don't understand it sometimes. It's a 20-minute ship. But still, I find it very difficult to, for example, to discuss the subject in Gozo is very, 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 very difficult.
I'm from Gozo, and there's much less education on it in general. For example, even with the Medical Student Association, they have sessions on any topic you can think about, but in Malta, in Gozo, it's much more difficult to get people who will talk about these things and give sessions to schools. So that is a bit of an issue. Yes, there's as Maria was saying, there's a huge difference between Gozo and Malta.
Guys, I have to leave you because I have another meeting.
Yes, thank you very much. This has been very insightful. Of course, this conversation needs to be longer, but
Yes.
for today. So I want to thank you both for taking part in this project. I hope you both know that this is very important and that your experiences will be used and will hopefully give some insights to MPs for the future of Malta. So I would just like to thank you once again.
Thank you as well.
You're welcome.
Thank you for watching our podcast. We hope you found it fruitful. So, what are we going to do with these podcasts?
On the 11th of May at the Valletta Design Cluster, our young people will be sharing the results of these podcasts and the research around the project to our guests, which will include MEPs and MEP candidates of the upcoming election.
Join us on the 11th of May at the Valletta Design Cluster by registering through the link on this post or by contacting us on info@ymcamalta.org.
See you there.